Hey, I'm Dr. Jonah Amtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I'm double boarded, I'm a teacher, I'm an author, and I'm a surgeon. I only do cosmetic facial surgery from here to here, and I don't do boobs, bellies, or butts. Cosmetic eyelid surgery, or blepharoplasty, is one of my favorite operations, and I've done over 7,000 eyelids. It's a great operation because it's a much easier recovery than, say, facelifting or other procedures that we do, and it makes a big difference for patients, making them look more youthful and less tired. I want to talk today specifically about some of the things not to expect when you have eyelid surgery, okay? And we're going to start with festoons. Now, I have numerous videos on YouTube about festoons, and festoons are these little pooches that we get kind of below the eye and above the cheek, right? So it's not really the cheek, it's not really the eye, it's that region there. And these happen from aging, they can be heredity. They also happen because the lymphatic tissue gets backed up in that region, and that's called lymphedema, and they just become waterlogged or boggy. So festoons can be a real challenge, and there are numerous ways to treat them, but I want to talk about a specific scenario. So somebody comes in, and let's say we're going to evaluate them for upper and lower eyelid surgery, okay? So I'm going to do laser-assisted upper lid surgery. I have many videos online of that. I'm going to do transconjunctival lower blepharoplasty from the inside, so there's no scar. Got a bunch of videos on that. And I'm probably going to laser the lower lid skin as well, okay? Now, that's kind of treating the eyelids. And as a courtesy, we'll go down and we'll laser the festoons, okay? I explain to every patient that one laser is not going to make those festoons go away. And we can laser those under local anesthesia, chairside, after their surgery, but it will take several treatments. And even with several treatments, sometimes it's almost impossible to make these go away. Now, there are people out there that say that they guarantee that they can make your festoons go away, and I have a lot of successful cases, and I have videos on that as well of treating festoons. But what's important, people come in for their eyelids, okay? And my consents, my discussion, everything focuses on the fact that, look, these festoons are not part of your eyelids. We're going to help you with them. It's not going to make them go away. And what's really disheartening, despite all this communication, is when people come back and they say, oh my gosh, I love my eyelids, but look, I have these bags on my cheeks. Well, I have to go back and say, remember we talked about that, okay? So your expectations with these festoons have to be, they have to be honest. You have to understand what's going to happen there. All right, that's topic one. The other thing is, I will do eyelid surgery, and people will send me a picture like this, and they'll say, I still have wrinkles, okay? It's important to understand that I don't care how tight and how nice you make somebody's lower eyelids, when they smile or squint, and I'm talking about adults, they're always going to have wrinkles there. If you made it so tight that there were no wrinkles, it would pull your eyes down, okay? So again, when you look at somebody in a before and after picture, you're looking at a still picture, so to speak. But when people animate, they're always going to have nasolabial folds. They're always going to have some crow's feet. They're always going to have wrinkles under their eyes. So blepharoplasty surgery can really be effective. It can really make people look younger and more alert. But the two things that you have to have a good understanding about are, number one, festoons, and number two, what to expect on the skin there. Finally, and I'm going to show you some pictures of before and after pictures of some of my blepharoplasty, but finally, you also have to be careful how you treat the lower lid here. I don't agree with it. A lot of people make incisions under the eyelid on the outside. You can see the scars. When I say I don't agree with it, I mean, if that works in their hands, that's fine. But oculoplastic surgeons will tell you that a big part of their business is correcting eyelids that have been pulled down like that, lower lid malposition. And you tend to get more of that when you do external incisions. So again, whatever anybody else is doing, if they have safe surgery with predictable outcomes, that's fine. But I really never make lower incisions there and approach the fat from the outside. I may do a little skin pinch, but that's a different situation. All my lower eyelids are done from the inside, so there's no scar. And what's very important is that has much less incidence or no incidence of pulling the lids down. Okay, so just some things to understand. Sit back here, I'm going to show you some pictures, and thanks for your time.